So Jag, as a super successful implant surgeon, I think people watching this are going to want to know, if they were starting out as a dentist and they want to get into implant dentistry, what are your key bits of advice that you would give someone young who wants to get into it?
There's 3. Get in straight away.
What?
Never too young. And by get in, get a mentor, go to practices. People like myself, we're quite happy to say, come and see us work. We like to sort of be involved with the younger people. Come along, from day one, immerse yourself in the environment. And make it sound normal and feel normal to offer your patients from day one, as you should, implant surgery. So from day one, start the journey, initially observing, then getting mentoring, then getting involved, formalizing it, and then eventually either keeping yourself purely in that role or adding other factors in, such as today, the mini smile makeover conference.
But I mean, how early do you say? Would you say if someone had just qualified, that it's a good time for them to come and sit with you?
I think that's perfect time.
Really?
Yeah, because from the outset, the same patients are going to come into your practice,
True.
whether you're an FD, whether you're first year post-FD. So you really should have enough knowledge to know what is appropriate, what isn't appropriate, for the conversation. So absolutely, from day one.
All right, so then, let's say I'm a young guy, I come and watch you.
Yeah.
So then I know what's possible.
Yeah.
At what point should I start actually drilling for implants and actually doing the work?
It's
straight away?
No, not at all. No.
Okay.
I think it's important definitely to find yourself a happy medium. Basically, when your confidence is greater than your competence, you're in trouble.
Yeah.
So find your own competence levels in observing, in assisting, in co-diagnosing, in getting involved with retracting during surgery, following a formal course, getting a mentor, eventually in placing yourself. Or don't get involved surgically at all. Go down the restorative phase, go on designated courses. Make sure you're doing everything within your competency level. The important thing is, if it's for you, you find out very quick. It's very contagious.
So you're doing mainly all-on-4 cases now? Or?
Bigger cases, a lot of all-on-4s, a lot of full mouth implant cases. I'll still do the occasional, quite a few sort of singles and laterals and 2 or 3 at a time, but my preference is full arch rehabilitation.
And you don't only do implants?
No, I've got 3 sort of stakes in dentistry these days. Implant surgery, particularly full arch implant work, aesthetic restorative, I've been doing that for the last 28 years, and a lot of orthodontic work. I was quite fortunate about 10 years ago to be one of the first guys over in the States, actually, being taught 6 Month Smiles by Ryan Swain, the actual owner of 6 Month Smiles at the time. So that was, about 10, 11 years ago. Do a fair bit of Invisalign, want to do more, but the 3 aspects of orthodontics, aesthetic restorative, and implant surgery mean that I've actually got quite a pretty good chance that I can sort most things out without referring out when patients come into my practice.
How come, though, you haven't sort of stayed in one of those 3 lanes instead of doing all 3?
I get bored easily.
Is that the case?
I get bored easily. If I'm engaged, I'm 100% in. And if I just did one of those factors, I'd get bored. So I think the sensible thing for me is knowing if I split my time a third, and there'll be months where I'll do a lot more implant work than orthodontic work, and other months aesthetic restorative. It allows me to delve into all 3 aspects, and plus give a full multidisciplinary appropriate treatment to patients, no matter what walks through the door. So it might be that I think something is not, going to stimulate me enough, but I'll advise the patient, and I'll get one of my associates to do the work. That's happening more and more often. But it's nice to have those, for me personally, to have those 3 aspects of dentistry, which in themselves could quite easily, I could do full time, any one of those 3. But keeping the 3, broadly speaking, available to me on a daily basis, it stimulates me.
So yeah, I mean, for me, it's quite interesting. Someone like you who's so involved in deep implant treatment to then come onto a mini smile makeover course.
Absolutely.
And we see the odd 1 or 2 people. Yeah. And what I'm thinking is that continuous learning the reason why you got so good at implants in the first place? That curiosity.
Possibly.
Because if I think about it for myself, if I was at your level at implantology, I wouldn't really be bothering with composite. It's just, I'd be just there.
No.
But you're here, and you're humble enough to be learning from someone like Dipesh, who's 20 years younger than you. Yeah. And a lot of times we hear that, we hear that, oh, I don't think he can teach me anything. So what is it about you? Is it a curiosity?
I'll sponge off anybody. I don't want to be a pioneer. I don't want to do the legwork in having to learn everything afresh and
make all the
mistakes.
Yeah.
I'd rather say, what part of dentistry is interesting me? Who's doing well? Who's ethically, morally, and professionally being successful? Not just professionally, but business-wise as well. It's important. And thinking, right, let's copy, let's learn.
Yep.
But let's do it directly from the horse's mouth rather than from somebody who's been there. Now, the good thing with this the reason I've really come for the last 2 days, and it's been a fantastic course, by the way, genuinely, I'm not just saying that, in that I sell myself, so to speak, to patients as, if you have a dental problem and you want an aesthetic, functional, long-term result, anywhere in the range from the smallest little change you want to make to full mouth rehabilitation, I can provide that for you. And the good thing with this is, this allows me to get those patients early on, young, old, immaterial, who literally just want, preferably no injections, no drilling, very cost-effective treatments. When I can say, actually, you know what, you're on a scale of 0 to 10, where 0 is minimum intervention, no intervention, 10 is full mouth implants, I can provide the whole range.
It's interesting.
So pretty much all three aspects.
Are you finding that patients are asking for composite now? Is that something you...
Well, they're coming and saying, I want bonding.
So that's new, isn't it? How long ago did that start happening? Very recently.
I think, to be honest, pretty much since you guys started doing stuff online. Yeah. I think there's a cause and effect there. So I would say, different within the last year or so.
Yeah.
Specifically coming in, with like bonding. Sure, not a problem. What I do like about the way this mini smile makeover, together with the lighting, is all put together, is it provides very much a package type approach for the patient, where we can say, great, we can whiten them, we can straighten them if you wanted to, we can contour them. So at every stage, you're one step further than you were. And you can stop at any one of those stages. You haven't got to go through the whole triumvirate.
Yeah.
You can stop, you can reassess, or you can say, I'm in for a penny, in for a pound, I want all three things done.
That's what TIFF calls progressive treatment planning.
Right.
Not knowing at the very beginning where you're going to end up, but as the thing goes on.
Right. Well, I haven't met TIFF for a good 7 or 8 years now.
That's what he calls it.
Yeah.
You owned a multiple number of practices.
That's right.
What would you say is the key to managing lots of practices?
Good managers.
Do you have one in each, or do you have
one in each?
Area managers?
I used to have a lot more clinics than I have now.
But when you had lots, what was the key? I mean,
key was having good managers, and we've all, had bad managers in the past, and they've come and gone, which is good.
Do you think you're good at hiring?
I don't actually hire. That's a bizarre thing.
Someone else does that?
Yeah, once the manager's in, they will hire. Apart from dentists, I don't get involved with the nursing staff, even with the hygienists. The manager will hire them because they're spending more time. I do get involved with the firing. So it's very much a case of a lot of the staff, virtually all my staff, that are new within the last sort of 18, 20 years have been hired by fantastic managers. The last 20 years I've had some fantastic managers. I had some bad managers before that. Very much a case of, the reason I can cope with it is, it's all stressful, but the stress levels from one practice to two practices is a massive stress. 2 to 3 and 3 to 4 is
that right?
There's a certain amount of duplication that occurs. But then it gets to the stage where you realise that actually sometimes less is more. It's the old thing about, being a busy fool if you're not careful.
How about when you've got a number of practices and you've got managers in each one, how often are you in touch with each of those managers?
Daily.
Oh, daily with everyone?
Must be, yeah. Otherwise it's pointless.
And so you're literally trusting them to tell you what issues there are?
Absolutely, yeah. And the good ones,
yeah.
Especially the last 6 or 7 years that I've had, are not just good, but they protect me from the majority of
issues going forward.
If it gets to me, it's been through a triage process of it's not important, or it's vexatious, or they can deal with it. By the time it gets to me, it's a particular clinical issue which nobody else can resolve, or it's something that sort of legally I'm duty bound to do.
What would you say has been your lowest point? professionally?
Professionally,
Yeah. What was like a bad day, something that went really wrong?
well, there's loads of those.
Yeah,
But they only last for about 2 hours.
So
So the next patient comes in, and then you're on a high. Catch me at 6 different points throughout a day. I'll be the happiest person in the world. Why am I doing this? Happiest person in the world. Why am I as long as at the end of the day, when I close my door, see, I do no dentistry work outside of hours. I don't worry about it. I don't think about it. I have got quite a binary switch off. I don't stress about it. When I'm gone, I'm gone. When I'm working, you can lay on as much pressure as you want. It's not a problem. So I think genuinely, I've got a healthy attitude in what's the worst that can happen. You know, if you're healthy, you can eat, drink, and chew. We're doing better than most people. We're actually in a phenomenally impressive profession. And you can pick your own level of stress. I mean, a lot of the stress that we put on ourselves is greed for more patients, or greed for trying to yearn for more complicated treatments. So I think as a profession, we're hard done by for definite, by the government and some of the regulatory bodies. But a lot of it, if you think, actually, in the scheme of things, we're doing good. We're doing well. And I think I've got a very, I take nothing for granted. I feel very grateful for the profession. And the bad days where things go wrong with patients, go wrong with labs, go wrong with associates, go wrong with staff, I sit down and think, actually, it's all good. You know, I'm not down a coal mine.
What kind of a boss are you?
Very hands-off.
Authoritarian? Or?
No, very hands-off. My staff actually laugh with me because if any of the other practice nurses come to work with me, they're initially nervous, but my staff said I'm the easiest dentist to work with. I'll do most of the stuff myself if I can. You know, I'm very sort of nurturing from that point of view. There's a line. If you cross that line...
Yeah, what happens?
I've got a long fuse, but when I blow, I'll blow. So this is why it's quite good, important for me to have managers that keep all the stuff that might, you know, drip effect for me to blow one day. Well, literally, it's not an aggressive blow. It's very much a case of, right, it's like a dad saying, you really let me down. And because I'm always praising them, for them to hear, you've let me down, that was not called for, and then walking away, that's actually more hurtful. In my opinion,
how do you manage to juggle 6 days a week of clinical work?
Easy.
And running lots of practices at the same time? It's again, the managers.
Easy. It's the managers, but I take 8 or 9 weeks a year off now. So I never used to.
Yeah.
And it's very much a case of when I'm at work, I'm at work. Yeah, there's no coasting. There's no, well, we're here, we'll take it easy. You're at work, we are at work. When the door gets closed, I'm off. So the last few years, I'm taking 8, 9 weeks a year off.
But are you actually off? I mean, what happens? You don't talk to the managers when you're off?
Not off. But maybe a phone call every couple of days, yeah. Last year was different. I took a month off, 5 weeks off. You know, I went to Africa for a couple of weeks on safari, then I went over to the States for 2 or 3 weeks, and I think I contacted work 3 times. But I've only got a small number of clinics now. And it's easy to manage, to be perfectly honest. The girls are great.
What's your advice then? If you had to give now advice to someone who wants to go into the multiple practice game, would you say to do that? Or would you say, now that you've downsized, would you say you're more comfortable in this situation?
No, I think it's all good. I think if your personality trait is you're going to be, if you're going to sit in one place and feel like you're confined, not just by the walls, but by, you know, if basically your idea of a holiday is lying on the beach for 2 weeks, I'd stick to one practice. If your idea of a holiday is doing that, but you know every day you are reading books about something, or business books, or traveling, or whatever it is, and you're very active all the time, multiple practices can work. I mean, I know of at least 3 people that have 20 plus practices. Happiest people you ever meet in your life. They're the first in the bar, they're the last out. They work extraordinarily hard. And if you ask them how they're doing, they'd say, doing great. Whereas on other people, I think sometimes one practice is lonely, but I think I would rather have one well-run practice than
So it sounds like you kind of
badly.
thrive on the pressure.
Yeah.
Is that
That's true.
I'm not going to call it an adrenaline junkie because it's kind of different to that. But
Yeah.
but you do like pressurized situations.
Yeah.
Which is going to bring. I mean, being an implant surgeon itself is a pressurized thing, but having lots of practice and being an implant surgeon at the same time, you think you work well under pressure? Is that
I think so.
And bored easily.
Yeah.
That's
It's a dangerous combination, but it's good. But the thing is, I think I handle it well. My staff tell me otherwise. They can tell. When I'm under pressure, I think I'm being quite cool about things and everything's good, but they can tell a difference in my demeanour. From very jovial and laughing and joking with patients, a very matter-of-fact, but still very jovial, but very bang, 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 bang. So I would say any younger colleagues, stay positive. Lots of doom and gloom out there. It's a fantastic profession.
Have you got kids?
I've got a 3.5-month-old baby.
Oh, really?
So as time goes on, when he grows up, we'll see.
But would you, like, if you had a kid who was 18 now, would you say go into dentistry?
Well, my girlfriend's got a lovely 14-year-old lad who he's our lad and he's phenomenal. And he keeps saying, Dad, I want to become a dentist. I said, son, come on, let's do it. But having said that, I think whatever level of profession you choose, as long as you aim to strive to be the best that you can, but also if you aim to strive to just do the best at that moment in time, things change, personalities change. I have 10 nieces and 1 nephew. 6 of those are doing dentistry, 2 are dentists now.
You're kidding?
No. So it's very much a case of I wouldn't push anybody into it. If you're in it and you're a student or recently qualified, stay positive. For every person that you hear in the press and dentistry or courses that there's doom and gloom, I guarantee there's somebody who's delighted with the profession. Search out those that are positive, that will give you value, that will literally say, hey, open house, come and visit. Nothing to hide, learn. A nurturing, almost like a familial approach. This is the best profession in the world, in my opinion. I mean, where else can you be the physician, the surgeon, the radiographer, the businessman, the confidant, the artist, the scientist, all in one, and whatever level avenue you think is more your forte, you can engineer yourself towards there. Massive challenges in the profession. It's a lonely profession a lot of the time. So if you're somebody who likes isolation, fab. If somebody likes to actually have a fantastic social life, a good living, but most of all feel professionally advanced in their life, you've got to keep going on courses. You're never too sort of old to learn. The day that you think you know everything, just forget it. And coming to places like today, it's a composite course, anterior composite course, but it fits perfectly into my whole range of smile makeovers.
Have you been on a composite course before?
Yeah, oh God.
It's been a while.
10, 12 years ago. It's been a while.
What do you think of Dipesh?
He's all right, isn't he? Yeah. The lad's done good. Extraordinarily impressive work, but just as impressive as delivery. Humble, down to earth, very, very, very knowledgeable and extremely good at actually getting that point across.
Yeah, so one thing with him at his age, for me, is interesting. It's one thing being good at dentistry. There's another thing being good at teaching dentistry.
He's what, 12 years old now, is he?
Yeah, 12 and a half. Teaching dentistry is different to dentistry itself. He is a very good dentist, but he's getting better and better and better at teaching it.
And I think no matter what profession, if he was an architect, you can pretty much be sure that somewhere along the line there would have been a teaching role, or an advising role, or a mentoring role. So I think it's very much like the artistic bent. If you've got the way of getting yourself across in easy, relaxed ways, but quite an authoritative way, it's, this is what I do, and it's bloody good. If you want to copy me, fine. If you don't, not a problem. And there's no judgment. But there's very few educators that I've seen. I mean, I've, over the last many years, been with a lot of different
Who are your mentors? So Mallow?
Paolo, Prof. Mallow. Long story, but he threw me into his swimming pool off one of his diggers, in his farm. Back in the day, David Hornbrook, Patrick Palisai. I spent some time over his clinic over in Marseille. There's been a few over the years. And a phenomenal thing was about 10 years ago, 12 years ago, I went over to San Francisco for 5 days, and Michel and Pascal Magnier did a 5-day hands-on aesthetic porcelain course with them.
Nice.
Which was, again, a phenomenal level of work with the two main people there in UCLA. And, but I've got to the stage now where, looking back, I'm thinking, if I'd have known what I know now, instead of getting involved in that 7 years after I qualified,
you'd have got it straight away.
Day one. I mean, there's
back then there weren't that many courses.
No, that's true.
Which year did you qualify?
91.
Yeah, so I qualified in 95, and I remember wanting to go on an aesthetics course, and there was one in New York.
Yeah.
And nothing in the UK at all.
Absolutely.
There was nothing you could learn.
Exactly. Look, today, there's a couple of newly qualified dentists here.
Quite a lot of newly qualified.
And I'm sitting next to them, and they are enthused.
Yeah.
There's 30 people here. Is it 30 candidates here today? And they're enthused. Now, in those formative early years where whatever path you put on is going to go down that path, to be involved with other people like-minded who are enthused, who are social media savvy, you start thinking some of these are going to be the educators and the diplomators and people like yourself in the future. And it's true, and so you think, actually, this is the right time to get into, because that continuity, that momentum's already there. You finished uni, you've done your FD.
You're on that learning path.
On that learning curve. And as soon as you step off it, that's when, the background noise of life can just get in the way.
Back in our day, it was just considered that you put your time in.
Absolutely.
At the beginning.
Absolutely.
Because I did a good 4 years.
Yeah.
Before thinking about proper education.
Absolutely. I mean, I qualified in 91, and it was the last cohort that VT wasn't mandatory. So I went straight to become an associate. We were seeing 65, 70 patients a day.
70 a day. 5
patients, so a patient every 5 minutes.
Wow.
For 2.5 years. I knew the day after I started, this is not for me. Not for me in doing that work, is not for me being an associate.
Yeah. Oh, I see.
So the next day I started looking for practices, literally the next day. Handed my notice in the next day.
So how many years out were you before you opened your first practice?
Just over 2.
Oh, wow.
Because I took my time, did some locum work, but I told my principals the second day, this is not for me. I'm going to hand my 3-month rolling notice in, and they were very good. They said, fine, whenever you find a place that's decent, correct and proper and you want to go. So at the outset, I was looking for courses. I mean, in the past, I had to travel everywhere. I spent a lot of time in the States, in South Africa, Europe an awful lot on various courses. We are so, as you said, we are so lucky now that these new graduates...
Sport for choice.
From day one. In fact, instead of the question as to which course is there, it's which course should I go on? Yeah. And to have such enthusiastic, really driven youngsters.
It's nice to see that.
It is, it's contagious.
Absolutely.
And the exciting thing is, this is just the start of it. As they come through, it's don't want to sound too sort of evangelical about it, but it can only have a positive effect.
All right. Well, I won't take up any more of your time. Thank you so much for coming on Mini Smile Makeover.
Thank you for having me. Good to meet you. Thank you.